Hi, I'm Dr. Michael Putman. I'm a chiropractor here in Roseville, California. I'm a specialist in treating fibromyalgia and other chronic illnesses. I'm currently studying with two of the world's leading chiropractic neurologists, Dr. Frederick Carrick of the Carrick Institute for Graduate Studies, and Dr. Michael Johnson, author of the book What to Do When the Medications Don't Work, a patient's guide to treating dizziness, migraine headaches, fibromyalgia, and other chronic conditions. Today we're going to talk about our approach to treating fibromyalgia. But before we do, I just want to let you know that this is about a 5-minute primer on our approach to treating fibromyalgia. If you want more information, you'll have to request a DVD. We have a 25-minute DVD that thoroughly explains our approach and how we treat fibromyalgia. You can get it by going to www.rosevillefibromyalgia.com and request that DVD, and we'll send you that along with some other information. So, first of all, when we talk about fibromyalgia, there's two things you need to know. Fibromyalgia is a metabolic and a neurologic condition. And you have to treat both aspects of it if you truly want to recover long-term from that condition. And that's why our approach is so unique and so different. There's no other doctors, in our area at least, that are doing the same kind of treatment that we're doing. So let me first explain to you a little bit about fibromyalgia, the neurologic aspects of it. Behind me you see this diagram of the brain. The way a normal brain works is the cerebellum, the back part of the brain, speaks to the front part of the brain, the cerebrum. And then the cerebrum talks to the brainstem. That loop, that normal loop, in many fibromyalgia patients isn't working properly. And so what happens is that the brainstem, which is both the gas pedal and the brakes for our body, goes full on gas and leads to a lot of different symptoms. That brainstem is not being regulated. And when that happens, the brainstem drives down the spinal cord and activates what's called C fibers. C fibers are nerve fibers, and they're for pain. And what happens when this occurs is that the threshold for those nerves is decreased, which means it doesn't take as much stimulus to activate them, which means it ends up bombarding the brain with a lot of information, pain information. And that's never a good thing. So what we do in our office is that we focus on restoring that normal loop. And the way we do it is we recognize that the brain needs two things. It needs fuel and activation. And fuel for the brain comes in the form of glucose, so the things that we eat, and oxygen. And we find that many patients with fibromyalgia have deficiencies in both areas, but most importantly, that their oxygen is depleted. Their brain's not getting enough oxygen and their body's not getting enough oxygen. So we want to work on ways to increase their body's ability to carry and deliver oxygen. The second thing we focus on is activating the brain. And the way you activate the brain is through all the senses: sight, sound, smell, touch, taste, and movement. All those things activate the brain. They stimulate the brain. They restore normal function to the brain. So we use what's called brain-based therapies to do that. So that's our neurological approach. The other aspect of fibromyalgia that needs to be treated is the metabolic aspect. And to treat the metabolic aspect, you absolutely have to do the appropriate tests. And I have a lot of patients that come in with fibromyalgia. They may have been diagnosed for many, many years, and they'll tell me over and over again, I've had all the blood tests, and they all come back normal. And my answer and my response to them is, well, if they're coming back normal, why are you feeling the way you feel? And then I go on to explain that you need to understand what normal means when we talk about blood tests in the medical model. Okay? Normal values for blood tests come from all the people that have taken that test over the last year. And over the last 50 years, as the American population as health has decreased, that normal values have gotten wider and wider and wider. The second thing you need to understand is that those normal values are not healthy values. They're pathologic values, which means that normal ends right where pathology begins. So that if you have a score of, say, 3.0, you're considered normal. But if you have a score of 3.1 on a given test, you have a pathology, you have a disease process going on. So you can be within those normal ranges and be right at the edge of a disease, but still be considered normal. And most people will fall into that category. And medical doctors, unfortunately, since they're specialists in treating disease, won't do anything about those values until you get into that pathological range. Well, what we focus on is what's called a functional blood chemistry analysis. We want to look at the optimal ranges where your body's working like it should so that you have a health. And so when we do these tests, we ignore the values that the labs give us and plug it into a computer to find the functional values. And then we analyze from that point. So we do a complete metabolic panel. We look at CBC with differential. We do a complete thyroid panel. We want to make sure your thyroid gland is working right. A lot of times when medical doctors do thyroid tests, they're testing exclusively for TSH, thyroid stimulating hormone. The problem with that is that that's only one aspect of what the thyroid does. What we want to look at is all the other aspects. We want to make sure that not only is the thyroid stimulating hormone being secreted in proper doses, but is it being utilized by the body like it should. If it falls apart in any one of those areas, then the body's not going to be working right, and you're going to have a lot of different symptoms as a result of it. We do an adrenal stress index. We want to make sure your adrenal glands are working well. We found that a lot of patients with fibromyalgia and chronic pain have problems with their adrenal glands. That's one of the reasons that they're having problems sleeping, and they're chronically fatigued. We want to look at an autoimmune panel, or immune panel. We want to make sure that your immune system is working properly and that your body is not attacking itself. Many patients with fibromyalgia and chronic pain have an undiagnosed autoimmune condition going on, meaning that some of their own cells are attacking their body. If that's the case, we want to find out why. It's not just enough to know that, that the immune system is not working right. We want to figure out why it's not working right. Is it because there's an active antigen in your body, some type of food allergy that you have? Is there any type of environmental stressor in your body, any environmental toxicity that will cause your immune system not to work properly? So we want to look at all those things. And then, of course, we want to look also at any type of food allergies. So we want to look at all those different aspects of your metabolic, your body's blood chemistry. We plug them into a computer, we look at it functionally, and we come up with a treatment protocol to restore normal balance to your body so that your body has an optimum opportunity to be healthy. So those are the ways that we approach fibromyalgia. If you want more information, please go to that website, www.rosevillefibromyalgia.com, order the DVD, and get the other information. One kind of caveat before I let you go. In our practice, in this fibromyalgia recovery program, we have a couple of requirements. First of all is that you take responsibility for your health. It's not my responsibility to make you healthy. It's not the government's responsibility to make you healthy. It's not your employer's responsibility. It's not your insurance company's responsibility. It's yours. And the second thing is that you need to be able to make lifestyle changes. If you are unwilling to make lifestyle changes, this program is not for you. So if those two things sound like something that you could deal with, please, again, go and order that DVD, and we look forward to hearing from you. This is Dr. Michael Putman saying good health and good life.